The terrible triad, also known as the unhappy triad, is a soft tissue injury in the knee that is comprised of three knee injuries that occur simultaneously. These injuries include partial or complete tears of the anterior cruciate ligament, medial collateral ligament, and the medial meniscus. This injury is common in both contact and non-contact sports and is the result of a blunt force directed towards the lateral side of the knee while the foot is fixated on the ground. Such a force can cause strain on the medial internal structures of the knee joint through rotation, specifically through valgus stress. Symptoms of this injury can include pain and swelling in the knee joint, catching or locking of the knee joint during motion, inability to move the knee through a full range of motion, as well as instability of the knee joint during a side-to-side or twisting motion. The ACL and MCL are two of the four major ligaments of the knee joint. They are comprised of dense connective tissue and are responsible for stabilizing the bones that articulate at the knee. The MCL attaches proximally to the medial epicondyle of the femur, distal to the adductor tubercle, and attaches distally to the medial condyle of the tibia. It resists force that would push the knee medially and prevents widening of the medial portion of the knee. The ACL attaches proximally in the notch of the distal femur and attaches distally at the intercondyle eminence of the tibia. It is responsible for preventing anterior translation of the tibia as well as medial rotation. The meniscus is a fibrocartilage structure situated between the medial condyles of the femur and the tibia. It serves to disperse the weight of the body and reduce friction during movement. During injury, the rotational forces cause excessive tension on the ACL, causing it to rupture. Although the MCL resists widening of the medial portion of the knee joint, when the lateral side of the knee is struck, the lateral portion of the knee buckles, causing excessive widening of the medial portion and subsequent tearing of the MCL. The medial and lateral menisci can be torn due to rotational force, but the medial meniscus is also injured due to coupling with the MCL. An anterior drawer test can be used as an initial clinical assessment of a ruptured ACL. The patient lies supine on a table with their knee flexed at a 90-degree angle. The examiner then grasps the tibia right below the joint line of the knee and applies a force to firmly draw the tibia anteriorly. In a positive test, the tibia pulls forward or backward more than normal, known as increased tibial translation, which is indicative of an injury as seen here for the patient's knee. This is what drawer tests should look like for an uninjured knee. Treatment for this injury normally involves ACL reconstruction and remodeling of the medial meniscus, while the MCL is usually treated through immobilization and rest.